Welcome in to another edition of BR Ortho Talk. Joined today by Dr. Craig Greene. It's a pleasure. How are you, sir?
Hey, good morning, my friend. Thanks for having me.
It's our pleasure to be here with you. And one of the fun things about this podcast has been not only an opportunity to talk about so much in the field of orthopedics, a lot of subspecialties, and passing along good information, but getting to know doctors as well. And your whole story, your whole family story, is so fascinating. Um, Give us the Cliff's Notes version of Craig Greene, growing up in New Roads and ending up at
Yeah,
Brock.
I grew up in a small town called Maringouin, about 30 minutes from here. Went to high school in New Roads. Matter of fact, when I told them my people I wanted to be an orthopedic surgeon, their comment was, "Well, guys like us don't get to do that. You got to go to Catholic High or somewhere in town." And I'm like, "Well, no, I'm going to do that anyway." And so, but yeah, I grew up on a farm and just working out in the sun a lot. Never forget, I was palpating cattle when I realized, all right, I'm going to study really hard. I don't want to do this the rest of my life. And then in high school, I got hurt a fair amount and even walked on at LSU. But after 7 knee surgeries, I was like, you know what? I want to do this for a living.
Mm.
And my wife tells me she thinks that God gave me most of the things that I take care of people for. So maybe I'll just have a little more empathy. And sure enough, I had a surgery this morning.
I was going to say, so 7 knee surgeries, and today hand, elbow. What do we
It
have
was another
here?
elbow surgery. I've had one shoulder, and this was my 4th elbow surgery. And it was just a pinched nerve, so I'll be back at work Monday. Uh, so it's going to help me, not set me back really. But I think the last time I was on a podcast with you, I'd had surgery on my other elbow.
You did. So, but it's actually it's a great validation of what you do and belief in what you do. So I'm really curious though. So being an orthopedic surgeon, is it tough to trust somebody else to operate on you?
Well, I'm fortunate because there's 36 of us, and there's 9 subspecialties within orthopedics. And for instance, I did a trauma fellowship. And so that's complex broken bones, the pelvic fractures, fractures that don't heal, etc. Also got board certified in sports medicine, and we call that micro trauma. I mean, if you watch a sports reel, it's particularly football, and you slow it down, you wonder how someone doesn't get hurt every play.
Mm-hmm.
And then as a mixture of that, I do a lot of joint replacements. But having said that, like our hand guys, all 6 of them are top notch. I trained at one of the best places in the country for trauma. They trained at some of the best places for hand and elbow, and so I have utmost confidence in them.
Yeah.
I had surgery at 6:30 this morning. I came out of anesthesia at 9:30, and here I am at noon.
So 2 hours after coming out of anesthesia, you're here doing this podcast with us, which is a little incredible. I'm wondering what might Craig say today.
Well, my wife's wondering the same thing. Sometimes the anesthesia is still lurking, but you'll get the raw and honest version. Um, no, but also, our goal is to get people back to their lives as quickly as possible, if possible, right?
Yeah.
And so I could have laid in bed all day, but I thought this was a perfect day to come do this.
We're glad you did. Let's go back to what'd you call it? Cattle pitching? What did you call it?
No, so we had to palpate cattle.
What is
So
palpating cattle?
my dad, I was 14, and it was the middle of the summer. All my friends were playing golf or doing stuff, goofing off, and he took me out to the farm. We had Brangus cattle, and he gave me gloves like 2 feet long, and he said, "You got to use your left hand because you're right-handed. You got to write down their ear number and put your hand in, feel if they're pregnant or not, and write down yes or no,
Mm.
and I'll give you $2 a head." I thought, okay. And then about on number 3, I thought, I'm gonna study real hard. And then I thought, isn't there an ultrasound or something that you can do this without having to do that?
So after so after school, how did the path go from high school to college? You mentioned that you walked on at LSU
Yeah.
for football.
Yep.
When did you decide to give up football and
So, coming out of high school, I had injuries, but I was probably not an LSU football player. I thought about, came close to going to say Dartmouth or Duke or something like that. But then I got hurt, and so some of that was off the table. But I still got a preferred walk-on spot at LSU, and I thought, well, let me give it a chance, and I'm glad I did. I mean, some of my best friends to this day, that was my fraternity, and from 5:30 a.m. workouts to 3-a-days, and that. But even there, I got hurt more, and it was then when I had my 6th or 7th knee surgery overall. I think I had 2 or 3 while I was at LSU. I thought, I think I want to do this for a living. And I'm fortunate because some people don't know what they want to do for a living. And it's also part of the story I tell young people is that it's very devastating when your career ends, but everybody's does. But you can take something tragic and turn it into an opportunity. And so, yeah, it was the end of I should have ended my football career way earlier. But I would say something tragic like that to me gave birth to my profession.
Sure. Yeah.
And so I think there's a little story in there for everybody, no matter what your profession ends up being. There's going to be a way to overcome tragedy and make it into something special.
You mentioned doing trauma. What was appealing about that?
So I was in Texas for my residency, and our mentors are everything, right? And you can have bad ones, you can have good ones. And I had one there, and he was a gentleman. He stayed late. He was there before everybody else. Stayed later than everybody else, and he did trauma. And back then, nobody did trauma. And the idea was you're gonna be up all night every night, and trauma people don't have insurance, so it's really not a smart thing to do. At the time, Brian Griffith was one of my mentors. He still is. He's one of my partners here. He was a team doctor at LSU when I was there. And I said, well, I think I want to come back and do sports and help with LSU. He said, that gig's going to be taken care of for a long time. So, and I don't think if you do that, we'll have a spot for you here. But if you do trauma, we'll have a spot for you here. And he also told me, hey, go where you have good partners and where your wife wants to live, because patients are patients.
Yeah.
And sure enough, my wife was fine with. I don't think we considered like Aspen or anything like that. In hindsight, maybe we should have. It's 110 degrees outside, but we thought, okay, I want to go back. It's home, pretty much home. And turns out I was the first trauma guy in the state. It was right after Katrina, and so the only trauma guy that was in the state left. And so the first couple of years, it was just drinking water from a fire hydrant, because I was the only pelvic surgeon for fractures in the state. Now there's probably 30 or 40, and that's good for everybody, because you have highly trained people to take care of very complex problems. And it's turned into you don't have to be up all night. So we've got really talented trauma surgeons here in town, and they tease me because I don't do it. I had a patient come to me the other day, and I said, who sent you to see me? And they said, Dr. Smith. I said, well, he's a nice guy. He said, yeah, he told me he was going to send me to one of his older partners. And I'm like, golly, I'm the older partner now.
that is certainly an evolution throughout a practice, right? Whenever you become the older partner. But so much of your story, and there's a lot that I want to talk about. I do want to talk about some of the fractures in sports and ancient athletes and a lot of things that you deal with that do lead into sport. But you mentioned your wife, Kristen, as well, and you all have a big family. And your family story is really fascinating. For example, Kristen's an entrepreneur.
Yes.
And we were going to talk as well. Like, she just launched a tennis clothing company. Tell us a little bit about that.
Yeah. So she likes tennis, but she realizes that she really likes the clothing and apparel more than the actual sport. And she got frustrated because, ladies tennis can be intense. You're 3-0, you're 3-5, and that's in, that's out, whatever. And I was like, look, this is country club tennis. It's for friendships. Like, just go. So she's like, you know what? I like my friends and I like the clothes, and she'll play tennis a little bit. But yeah, I'm proud of her. She's very creative. She launched her own line. It's called Love All Tennis Company. And it's what she noticed was, like, when we were growing up, no one wore yoga pants all day. And now it's called athleisure. Like, you can wear that and you don't even have to go do yoga. And she noticed that if you were wearing tennis clothing, it was because you just stepped off the tennis court. There was not all day tennis wear that you could do. So I'm proud of her. She's in the middle of that. But we were laughing the other day because I said, golly, the last 10 years, let's review what all has happened. I went to business school in Connecticut every other weekend. I joined the Navy. I ran for office. We adopted a child from China with Down syndrome and autism, and you launched a clothing company. Is there anything else you have on the horizon? She goes, no, we're good. It's like, yeah, for the time being, I'm good too.
Just as a quick recap, like, all of those things legitimately did happen. Like, why? Let's kind of go back in order. Why did you choose to go to business school?
So I was chief of.
So you're already at Brock, by the way.
Yeah,
You are a practicing orthopedic surgeon
Yes.
who decided to go to business school at Yale.
Yes. Yes. So I realized that I was chief of surgery, and then that led into chief of staff. That was a 9 years of leadership position at Our Lady of the Lake. And I'm proud of Brock because I feel like we try to get way into the community. You know, we have guys that are LSU team doctors, and I feel like we try to let's get on leadership at different places, just to be embedded in the community, you know. But I also realized a lot of what was being talked about. I mean, I had learned a lot about my profession, how to fix a pelvis or do a knee or hip replacement, but the inner workings of management of healthcare, of business of healthcare. And so I looked around, and I wanted to get my MBA. I wanted it to be real, no asterisks. And there were 3 in the country that had an emphasis in healthcare. And one was Yale, one was Auburn, and one was in University of Tennessee, Martin. Which, matter of fact, my grandfather has a library there named after him.
Oh, no kidding.
But I thought, I wonder if they'll take a redneck at Yale and turn to find out if they'll cash any check. No, so it was every other weekend, and there were 3 tracks there. You could do finance, you could do sustainability or healthcare, and they're about 80%, 85% all the same, but just for a few certain electives, we did healthcare. But I'd fly up on a Thursday night, do school on Friday, and then Saturday till about 3, and then fly home. And Saturday night, my kids were waiting on the porch to go to Waffle House. So we do that, and then church Sunday, and it was just, I'm glad I did it when I did it because I don't think I'd have the energy to do it now.
Yeah. Well, after business school, you also mentioned you joined the Navy.
Yeah, so it's interesting. I got a letter. Now they probably sent them to a lot of people, and the Navy's short on orthopedic surgeons. Will you please consider joining? And I just couldn't throw it away. I always regret I never served. I think that people that do serve, they have some pride, and yet I was still going back and forth to Connecticut full-time orthopedics, and I was like, how am I going to tell my wife I want to join the Navy? I'm not even done going to Connecticut. So funny story, we were driving back from Florida on a little vacation for spring break, I think, for the kids, and we see a hearse pass with a flag on it. And she goes, that is so cool. Like, I really respect people that have served. And I thought, well, maybe there's a chance. So how am I going to tell her? So I realized, I told her, I said, look, I got to talk to you about something tonight at home later. And it's real serious. And of course, that puts her on alert. You know, if a husband tells a wife that, it's like, okay, do you have a girlfriend or cancer or, you know? So she was just like, oh, what's going on?
You're usually thinking it's something that's going to be negative.
Yeah.
Right.
So later that night, and I remembered, flashback or parentheses, I'd gone to Africa in 2013. I'd like to do mission trips. And I was over there doing a mission trip. It was a very difficult one in Cameroon. And I get back, and my wife tells me, she goes, you know, I'm very proud of you. But I want you to know, if the Lord is ever calling you to Africa full time, he's not calling me. I said, okay, noted.
Got it.
So that night, back forward to us, I got to tell her I want to join the Navy. And I said, look, she goes, what is it? You know, she's nervous and all. She goes, what is it? I said, I feel like God is calling us to Africa full time. And she goes, no. I said, I'm just kidding. I want to join the Navy. She goes, go for it.
That was a good setup right there.
Well, she flipped the script, though, because later on, I'm at officer school in Rhode Island. We could only talk 10, 15 minutes a day. And she goes, we need to talk. And I'm thinking, now she's doing it to me.
Right.
And that's when she told me, she said, look, God's really put it on my heart. She's a special needs physical therapist. I want to adopt a child, Down syndrome, et cetera. And so, you know, a year and a half later, and I thought of that Bible verse in James that true religion is to take care of orphans and widows in their distress. And so if God put this on her heart, who am I to get in the way of that? And so that led to Boomer. And in the middle of that, I ran for office and won. So.
So not only are you orthopedic surgeon, Dr. Craig Greene, you are MBA from Yale, Dr. Craig Greene. You are a commissioned officer in the United States Navy, Dr. Craig Greene. You are father of five children, excuse me. Boomer makes 5. And also, you are Louisiana Public Service Commissioner,
Yes.
Dr. Craig Greene. Why did you run for
Well,
office?
funny story. I remember asking one of my med school classmates is a guy named Kelly Scrantz. He's a neurosurgeon in town. Great guy. He's from Pro Bridge. And when I was running, right when I started my campaign, I said, "Hey, Kelly, I need a favor. I need your help. I want to run for office." And he said, "Yeah, I'll help you. You need to get an MRI of your brain. Why would you do that?" And I think my wife asked the same question. And I believe in citizen democracy. I think that we live in the greatest country in the world. Yes, we have our problems, but citizens get to be part of the solution, and that's a rare throughout history thing. That's a rare on earth thing today. To be part of, we're a representative republic. A democracy might be tyrannical, but to have a voice and a say in the next step of the future is a privilege. I think everybody should do it. I'm glad that's not my only gig. I think politics can be a bubble that
Mhm.
you can it can become toxic. But I've enjoyed serving. I have reelection next year, but I don't see myself as a politician. I see myself as a normal person who's serving in that role. As a matter of fact, I'll see patients and they'll say, "Hey, my knee hurts, and I have a question about my electricity bill." And so it keeps me connected and the pulse with real people.
uh, you sure there's nothing else on the horizon?
Not on the horizon.
Okay.
Yeah, I'm raising children. I'm having a lot of fun doing that. I've got one at USC. My daughter's at USC in California, and my son's at LSU. So we get to see him a lot. And I've got two. I got an 11th grader, a 7th grader, and then Boomer.
Hmm.
So home still beckons a lot.
Yeah, full plate, man.
Yeah.
But it's so admirable all that you've been able to done, all that you've been able to do, and all that you have done, and obviously as a healer as well, helping people who are injured, which is certainly a big part of the conversation today. And one of the things that we talked about is how much you've done with your orthopedic practice in relation to sports. And I know there's also a heavy emphasis on ancient athletes, for example, the guy like you or like me who our playing career, however, whenever it might have ended, is done, but want to continue to be active and competitive. Uh, how do you help those types of people at that phase of their life?
Well, and the first thing to realize is that a lot of us don't realize until much later that there are phases of life. There's chapters. A book I'm reading or I've read and I'm focusing on this year is called Disrupt Yourself. And what it talks about is every 7 years, your life changes. Matter of fact, physiologically, it's different from 7 to 14 to 21. And I'm turning 49 this year. And so I need to be able to flip to what is 49? What do the next 7 years look like? They're not going to look like the past. And sure enough, in business, there might be a new technology or a new platform. And so, to the degree that you embrace that, you can succeed. And it takes effort to learn the new way. But part of that is as we get older, our tissues become more friable. And I think guys like me and you, we still think we're in our late 20s, but our bodies are aging. And so, it takes much less force to create some of the injuries. In ancient athletes, we see a lot of like, oh, I tore my knee landing wrong. I tore my Achilles playing beach volleyball. And my goal for people is to put you back the way God made you and get you back doing the things you want to do. And what we're good at is identifying what is the problem and giving options for getting back to what I call the optimal version of yourself. I can't make it to where you never tore your ACL, but I can make it better than it is now.
Hmm.
And if you trust the process, that's therapy. That's the whole time thing. Then I think you can get back to doing 95% of the things you enjoy. And that's what we pride ourselves in, being able to do that, but also having, and for people, whether it's like a career-ending injury, maybe an injury they never expected. You don't expect to have injuries, they just pop up, is to give people a pathway for hope.
Is there, um, i- how do you encourage people or coach people, maybe for lack of a better phrase here, on injury prevention when you get to that point in your life? Like, I'm 41. What would you tell me or someone like me to say, all right, you want to maintain this active lifestyle? Here are the things to be mindful of So you don't end up on an OR table.
Yeah, so when we're younger, you take a collision sport like football, and our bodies could not handle that right now.
Right.
And so I think our brains have a subtle way of tilting us toward something. I loved to play basketball when I was little. I've had 7 knee surgeries. If I played basketball, my knee would swell up. So without any doctor telling me I'm not going to play basketball, my knee is going to tell me to go play something different. Well, now I play golf. I love the Peloton. And what I tell people is listen to your body and listen to your brain. If your brain told you to jump off the back of a pickup truck, we probably wouldn't do that anymore. There's nothing good that would come out of that. Now, they make those steps where you step down. And so as far as a sport, look around for something that your body, soreness is okay, but injuries you probably don't want. Now, let's take CrossFit, for example. I think CrossFit's incredible. I see a lot of injuries in people over 40 in CrossFit. And so what I tell people is, like, I've had 7 knee surgeries. I still do legs at the gym. If I do nothing, my knees hurt. If I do the wrong thing, my knees hurt. If I do this, that's as good as they can feel. And so I think there's benefits to the brain, to the psyche, to overall well-being, to being physically active. And so pick something that you can be physically active in. And if you get hurt, we'll put you back together. But if you start seeing a pattern of getting hurt, your brain might tell you to try something different.
Yeah, I think that's certainly that's great advice. I think some of the other doctors we talked to have also talked about the importance of stretching, which feels pretty obvious. But what are your thoughts on how people might plan out a day, a week, as far as a stretching regimen?
It's like anything. You got to do it, I think, 21 days to form a habit. And I'll tell people all the time, let's say whether I've done your surgery or not, here's some exercises or stretches to do. And make that part of your life. You don't think about when you brush your teeth, you don't see, golly, the dentist makes me do this thing twice a day. Oh, no, it's just part of your life.
Right.
And so, like my dad, after his knee replacements, now he stretches for 15 minutes every time he brushes his teeth. Mm-hmm. And I'm sure you're familiar with David Goggins. Mm-hmm. His new thing is he'll stretch for an hour and a half, 2 hours. Well, I don't have an hour and a half, but I stretch for 15, 20 minutes. That could be on a pull-up bar. It helps with my knees. Definitely, as we get older, our tissues become more stiff. And so to keeping them flexible, especially the knee, I tell people there's 3 things that matter. There's flexibility. And if you don't have flexibility, you cannot work on strength. And within strength, there's 2 forms of strength. There's power and there's endurance. And you have to build up both. There's not a pill that we can give you to give you strength. But you have to have the actual motion in order to develop the strength. And then that's why I like Peloton, is because that helps me on both endurance and strength. And then I'll ask some people, do you exercise? Yeah, I walk a lot at work. Well, then the only thing you're going to be good at is walking around at work. Mm-hmm. You have to overtrain to be good. That's why, the LSU football team, they overtrain so that they're ready in the 4th quarter. And so you have to overtrain for things that you want to succeed at, and that includes your muscles. And so the flexibility, strength, and as little impact as possible. It's believed that when you jog, you put up to 7 times your body weight through your patellofemoral joint, through your kneecap. So I see a lot of runners, and I laugh with them. My knee starts hurting in the 23rd mile. We don't have a 23rd mile pill.
Right.
I've never personally seen a jogger smiling while they're jogging. I think God made runners and non-runners, and I see the non-runners trying to be runners. And I'm a non-runner. If I jogged, my knees would hurt. But I don't tell people what they can or can't do. Let's try to get you to be able to do the thing that matters the most to you. But those are the 3 things that I think matter: staying flexible, staying strong. And I think it does feed into part of your brain to overall well-being, to have some regimen of physical fitness.
I'm a non-runner who ran 2 marathons. My body hates me for it.
Yeah.
My feet, my knees, my back. It was a very bad decision. When you talk about listening to your body,
yeah.
I ignored my body for about 2 years, and
I'll get you a doctor's excuse that you never should do that again.
Well, I don't think I would run to the mailbox today. Like, if you see me running, I'm running from something. Right, if I need to run. Fractures are also very common. I mean, not just like we talked about some soft tissue issues, but also like you see bone breaks in collision sports, and you saw plenty in trauma as well. How do people? I mean, obviously, you break a bone, you're going to go see the doctor, but how should people approach the severity of a bone break?
So it's life changing. And 50 years ago, if you broke it, they just strung you up in a cast. And so the evolution of fracture management has come a long way in the last 50 years. Technologically now, we have hardware for just about every part of the body. And it's just rebar made out of titanium usually. Now it's starting to be made out of other things, but um, anatomic specific hardware. And if you think about what we do, I tell people this all day. I don't heal. In my opinion, only the good Lord heals. But we hold it still in the position that we want it to heal in, and so that it can heal. And so, you don't expect to break your tibia long jumping, or if you get in a car wreck and you break your hip. But we are trying to restore function in that. Sometimes it's by a replacement, but oftentimes it's by fixing broken bones to get them to heal, which is a process. And the hard part, like let's say you're gonna have a knee replacement, you think about that for a long time, you get ready for it. No one plans on breaking their tibia that day. But fortunately now, if you have that, we have a way to fix it where you can be back to normal fairly quickly. Your life will never be the exact same, but you can overcome that to get back to what is close to normal.
Yeah. Um, I found it interesting when you were talking about the phases of life. Every 7 years you change, and so I was thinking about that in terms of your medical career as well. When let's take something like joint replacement. When you started as an orthopedic surgeon, compared to where it is where your joint replacement is now, how much evolution have you seen in those? I guess two decades.
Yeah, so I've been at it almost 20 years now, and it's interesting. There's some people that want the young guy fresh out, and there's some people, the guy that want the guy that's been doing it for 40 years, and I'm kind of right in the middle. Um, we try to learn every day from every patient, and so there's a learning that goes on in our brains, and as we do it. But fortunately, there's also been a technological improvements. For instance, they used to only last, let's say, knee replacements, hip replacements, 10 or 15 years. Well, they figured out on the polyethylene part, the plastic, the way they curate that now, it's highly cross-linked, gamma radiated, vitamin E coated polyethylene that I think would last 30, 40 years now.
Mm.
And then the technology also, not everybody is, but I really like the robot. The robot doesn't do the surgery. It's not like I sit in the corner and press a button and the robot does surgery. I'm still doing it, but it's giving me really thousands of data points throughout the surgery to make it even more precise. And some people say, well, how'd y'all do that before? And we go, oh, well, that looks pretty straight. We got good at that. But this is also, so the technology has come a long way. The medications, we put medications in and around the knee. When I first started, people would stay in the hospital 7 or 10 days after a knee replacement. Half my patients go home now, same day.
Wow.
And so I would say that technology, and so as a new orthopedic surgeon, like even when I did my trauma fellowship, there are ways to treat certain fractures now that had I done it 20 or 15, 17 years ago in my fellowship, I'd have been kicked out. But one of my mentors there, he brought femoral nailing or intramedullary nailing to the United States, and he almost got kicked out. So sometimes, the disruption of new things it takes a while for people to embrace. I do direct anterior hip replacement. Some of my partners that they were never trained on that, and so they just don't. They do a really good hip replacement, but they do it from posterior. And so, my motto is I want to have an open mind to new techniques. I also don't want to be the first or last to adopt a new way of doing things. I want to make sure that it's proven, that the literature bears it out, and is that something I would want?
So, what do you think the next 7 years may look like?
So, for me, like, I'll give you an example. And in this book, the study talks about, there's an S curve. So, and we confuse the wording on it sometimes when we say, oh, it's a steep learning curve. If you have a steep learning curve, that means you catch on very quickly.
Right.
and it's a long learning curve that you don't want. I mean, if it takes you 7 years to adapt a new computer system at work, that's too long.
Right.
But there's often a lot of work at first, and then it plateaus off. And when you get to that, you can either say, I'm never going to go through one of these changes again, or you can just keep doing the way you've done it the rest of your time. Or at that 7-year mark, you go into another S curve. There's going to be something new. So, sure enough, I think healthcare, I'd say the robot is fairly new. So I jumped on that pretty early. So I enjoyed learning about that. You know, we're going to have a new electronic medical record. And, you know, the high school I went to, you only took typing if you were going to not go to college, because their assumption was if you go to college, you're going to have somebody that types for you.
Right.
I mean, how messed up was that? So electronic records, I think what we'll see in the future is you will be in charge of your healthcare information. And if you have the data, then you have the power. And I think the patient should have the power on where they go, what they want, price transparency, et cetera.
What about for you personally? You've checked so many boxes. What about in your 7-year journey or 14-year journey? What would that look like?
So I very much prize my orthopedic career. I think if I could do it for 25 or 30 years, that's a huge success. One of the things that makes me a little sad about my profession is I've never been to a retirement party for any of our partners. A couple of them have died suddenly and spontaneously, or burn out in different certain ways. So, you know, I want to land the plane well one day. I want to retire saying, I think I had a great career. I tried to help as many people as possible, and I don't think I want to do it until I'm 90. It's also, you might lose some skills, you know.
Sure.
So I think 25 or 30 years. But for the next 7, I'm in the stride of my practice. I'm enjoying it a lot. I want to just keep getting better at it. I do think I'll have a second career afterwards. And that's part of what my MBA was yes, I want to help me in what I'm doing now, but I think there will be opportunities for me to do something different after I retire from orthopedics.
Well, the next 7 hours, maybe let that elbow heal.
Exactly.
Let's get that done. Dr. Craig Greene, it's always a pleasure to visit. Thank you for the time.
Hey, thanks for having me, Matt. Appreciate it.
This is another episode of BR Ortho Talk. Thanks for joining us.